Welcome to the PharmaVOICE 100 one-on-one video series with Taryn Groen.
Congratulations on being named to the 2020 PharmaVOICE 100.
Thank you, Taryn. Thank you for having me. And it's an honor and a pleasure to be here with you today.
Well, we're so glad to be able to catch you in our new virtual reality as it is. I know that Health Union has a really strong culture. Tell me why that was a paramount importance to you when you were setting up the company.
Well, first, I think culture is people. And as company grows, people are the single biggest asset for companies. And I think one of the biggest challenges as a company grows is how do you maintain the same spirit and how do you maintain the same culture? I think it's fairly simple to maintain a strong culture at 20, 25, 30, even 50 people. I think as soon as you have a 100 plus, 150, and then even larger organization, it becomes a much more challenging aspects of a company. And for us, who are a value-based organization, culture is at the center of everything, because ultimately, unless we have the right people, we're not going to be able to achieve what we want for ourselves, for the people that we serve, and quite frankly, for our partners. So it's always been like kind of a very critical part of our mission. I also asked my people in the last couple of years, when they interviewed people to join the organization, to make sure that they have a culture fit first, not necessarily academic or background first fit, because ultimately we can all learn new things, but how we're going to fit within the culture is actually going to be a high, probabilities of being an amazing person and enjoying your work even more. So it's been really important. I think also culture goes with values, and the values we've had for business have been very strong from the first day we had a company. We run a very transparent organization, both within and outside, which is also the values we want to see in people and in culture. We are inclusive. We want people to come, and those are not just words. This is the way we've been running, but they're all part of. I always say, like, today my biggest job is to maintain the culture of the company, because the second you have one ingredient, it's a little bit like cancer that comes and join, it can spread very quickly. And we really pay a lot of attention and try to do the right thing. It's a never-ending work. It's very, very important.
Excellent. And I know you're equally as passionate about patients and developing communities that work for them. Tell us what drives that passion for you.
I think what's interesting is, despite that we've been doing this for 10 years.
Congratulations.
Yeah, thank you. It's unbelievable. I try to cover my white hair with more gel than before, but we've been doing this for 10 years, and still today, one of the few organizations, if not the one that built a model for people, with our people before being patient. I think really important. That is, and run an open community model. And what I mean by this is that there are not just forums and closed communities where you have to disclose your full identity and who you are, and sometimes people are not comfortable with this. It's not that they don't want to participate and belong, but it's more that they're not necessarily comfortable with the idea of having to disclose too much information. And then on the other end of the spectrum, I think you have more than ever before a huge amount of health information, pretty general. I think large publishers have done a pretty good job at being a lot more, bringing a lot more empathy in the content that they write, but still they're not very focused on the person. They are more focused on large ecosystem from a content perspective. And we've been still trying to fit in the middle of serving people by really providing them the ability to, if they want to disclose a lot of information, that they can, and if they don't have to. But we remain focused on their primary challenges, which is the condition that has a primary impact on their lives. And quite frankly, it's what drives what we want to do every day. Is we consistently look at our model and how we can best serve people. We also understand that different types of people needs to be served differently. Some condition like Alzheimer's and others where we have to involve caregivers tremendously, where other condition, the people and the patient are a lot more engaged, where we have to provide them a lot more clinical information. Some of them want a lot more emotional information. It's an always evolving moment, but it's data-driven and people-centric. A little bit like the question you asked before about culture. We see each communities like having its own culture and identity and trying to provide them with the support they need within that culture and identity paradigm. And doing this in an open fashion, which doesn't mean it's perfect. It has its pros, it has its cons, but we're still doing it by evolving and really trying to do what is right for people first.
Excellent. Thank you so much for sharing your great insights, and congratulations on a tremendous milestone, 10 years. Well done, and wishing you continued success. Thanks for joining us.
Thank you so much. It's a privilege, and quite frankly, it's an honor. I'm very humbled, and I can't thank you guys enough. And thank you for all you guys are doing as well. I think a tremendous amount of work you guys are doing. Thank you.
For more PharmaVoice 100 content, visit www.pharmavoice100.com.